Assalamualaikum. My name is Wan Nur Atira binti Wan Ahmad Rizal. I'm from Diploma Pharmacy intake April 22. Today, I will be presenting about first aid. So, what is first aid? First aid is immediate treatment given to a person who is injured or suddenly become ill using facilities or equipment available at the time before the arrival of medical team. First aid is the help given to someone who is injured or ill to keep them safe and to cause no further harm. The role of a first aider is to give someone this help. So this is the purpose of aid, which is the aim of the first aid is include preserving life, preventing injury from getting worse, aiding recovery, relieve pain, and protecting the unconscious. The main objective is to save life. For your information, this is something that we should know as a first aider. The first one is danger, which is identify possible hazard. Stay away from any danger or move the victim to a safe area. The second one is respond. Make sure the victim are conscious. We can call the victim name and try to ask some question to the victim so that the victim are conscious. The third one are shout for help. Ask help from other people, or we can call emergency service like 999. Then next is airways. Make sure there's a open airways. Next is breathing. If there's no breathing, rescue breath. For example, do a CPR. Next is circulation. Listen of pulse. Check the pulse rate, rhythm, and also the volume. Next is disability or drugs. Assess range of movement. Make sure that the victim can move, or if the victim cannot move, check the victim injury. And last but not least is exposure. Check for any hidden injuries. Make sure to check everybody so that there's no hidden injuries. If there are any injuries, make sure to give treatment immediately. Next, let's move on to the situation, which is you and two friends were doing experiment in laboratory medicine. Suddenly, a minor explosion occurs. You have noticed that your friend has bleeding on her face and finger. In your role of first aider, explain how the management should act. These are some steps that we should do to help the victim before we go to clinic or hospital for further treatment. For face bleeding, first, make sure to keep her away from danger. Then, wash your hand first. The third step is apply pressure with a clean cloth or bandage for several minutes to stop the bleeding. For a lot of bleeding, pressure on the wound firmly for 10 to 15 minutes with a clean cloth. If the cloth becomes soaked with blood, put a new cloth on top of the old cloth. Don't leave the first cloth. Facial would often bleed heavily. Next step is remove any dirt particle from the area and let the water from the fountain run over it for several minutes. Don't blow on the wood. This can cause germs to grow. Next is apply an antiseptic lotion or cream or petroleum jelly. Last but not least is cover the area with adhesive bandage or gauze pad. Now let's move on to finger bleeding. As usual, Keep her away from danger. Then don't forget to wash your hand. Then apply direct pressure on the cut or wound with a clean cloth or piece of gauze until bleeding stops. Next, if the blood slops to the material, put more cloth or gauze on top of it and continue to apply pressure. So next, dressing the wound. Remove any dirt particle from the area and let the water from the pharmacy run over it for several minutes. Last but not least, apply antibiotic cream to reduce risk of infection and cover it with sterile bandage. For your information, every year millions of people are hurt or killed from injury due to inadequate response or lack of timely assistance. The biggest difference between victims who is survives and those who don't is the bystanders' willingness to help. Performing any sort of basic life support on victim while the ambulance is on the way doubles the person's chance of survival. So that's all for me. Thank you so much for listening. Bye.